All right, today we're going to dive into something that so many people deal with, chronic knee pain. You know, it's an incredibly common problem, but trying to figure out the path to relief can feel, well, super complicated and a little overwhelming. So in this explainer, we're going to build a really clear roadmap. We'll use the latest clinical evidence to guide us all the way from diagnosis to some pretty advanced treatments. Let's get right into it.
So what's really going on inside a knee that has chronic pain? Well, the most common culprit, by a long shot, is a degenerative condition you've probably heard of, but maybe don't fully understand. And get this, it's the leading cause of disability in the entire world.
And this really puts the scale of the problem into perspective. Almost 23% of all adults over the age of 40 are affected by knee osteoarthritis. Just think about that for a second. That's nearly 1 in every 4 people in that age group. So this is not some rare condition. It's a hugely relevant issue for so many of us.
Okay, so let's start right at the beginning and define the main culprit here. Because really, understanding what knee osteoarthritis actually is, that's the very first step toward managing it the right way.
You know, this definition is so important. We often hear osteoarthritis just described as simple wear and tear, but that's really not the whole picture. It's actually a disease of the entire joint. It means you're getting a progressive loss of that smooth cartilage that cushions our bones, and it even causes changes to the bone underneath it all. And of all the joints in the body, the knee is where this happens most often.
So how do you even know if you have it? You might think an X-ray is the be-all and end-all, but the reality is actually a little more surprising and, frankly, a lot more personal. And here's the crucial point. A doctor can often diagnose knee osteoarthritis just by talking with you and examining your knee. It's not always about the high-tech scan. They're looking for a few key things, right? Are you over 50? Do you get that morning stiffness that kind of goes away after about 30 minutes? Is there tenderness or a creaking sound in the joint? Ultimately, it's your personal experience, your symptoms, that guide the diagnosis.
And this slide highlights what I think is a fascinating paradox. Relying only on an X-ray can be incredibly misleading. Research shows there's a surprisingly poor connection between what an image shows and what a person actually feels. Someone with what looks like severe bone-on-bone arthritis on an X-ray might have zero pain. And on the flip side, another person with a totally mild-looking X-ray could be in agony. This is so important. Your symptoms are what truly matter.
Okay, so once you have a diagnosis, where do you even start? Well, the treatment pathway begins with a really solid foundation. These first steps are considered essential for every single patient with knee OA.
This foundational care is really a three-pronged approach. First, it starts with education, just understanding your condition and managing lifestyle factors like your weight. Second is physiotherapy. This involves specific exercises, both on land and in the water, that are proven to reduce pain and improve how your knee actually works. And third, to help manage the symptoms are those first-line medications like paracetamol or topical and oral anti-inflammatories, which you probably know as NSAIDs.
But what happens when those first-line treatments just aren't cutting it? When they're not providing enough relief, well, that's when we look at the next level of care. Minimally invasive injections that go directly into the knee joint.
This table breaks down the 3 main options really nicely. So first up, we have corticosteroids. These are powerful anti-inflammatories that are recommended for short-term relief, especially if you're having a painful flare-up. Then there's hyaluronic acid, which kind of acts like a lubricant for the joint, but it's only conditionally recommended because the evidence is still a bit mixed. And finally, there's platelet-rich plasma, or PRP. For this one, the current consensus is that there just isn't enough high-quality evidence yet to recommend it as a standard treatment.
Now we get to a really innovative approach, especially for that stubborn, therapy-resistant pain. Instead of treating the joint itself, this technique focuses on the nerves that are actually sending the pain signals in the first place.
Okay, let's take a look at this. Your knee isn't just bone and cartilage, right? It's surrounded by this whole intricate network of sensory nerves. They're called the genicular nerves. You can see them here, highlighted. These are basically the highways that carry pain signals from your knee all the way up to your brain. So how do you stop those signals? This is where a really cool procedure called radiofrequency ablation, or RFA, comes into play. As you can see in this illustration, a specialized needle is guided right to these specific nerves. It then uses heat to create a tiny lesion which interrupts that pain signal, effectively turning it off before it can even reach your brain. It's like flipping a switch on the pain.
And this isn't just some experimental idea. What's absolutely crucial to understand is that this treatment is officially recommended. Clinical guidelines actually state that for patients with moderate to severe pain from osteoarthritis that just hasn't improved with other treatments,
RFA is a recommended option. Whew, we have covered a lot of ground, from diagnosis all the way to these different treatments. So now, let's put it all together and just visualize the entire journey from start to finish.
This flowchart here shows the complete clinical pathway. It puts everything we've been talking about into one single logical sequence. You can see how it starts with combining those foundational treatments: physiotherapy, weight loss, simple medications. If the pain continues, the next step is to consider second-line options, like a corticosteroid injection. And then, if your symptoms are still moderate to severe after about 6 months of trying these things, that's the point where radiofrequency ablation becomes a really important option to consider.
At the very end of this pathway, for end-stage osteoarthritis that is refractory, and that's just a fancy word meaning it hasn't responded to any of these other treatments, the final option is surgery. This typically means a total knee arthroplasty, which you probably know as a knee replacement. The whole goal here is to restore function and eliminate pain by replacing those damaged joint surfaces altogether.
So after seeing this entire journey laid out, I think the key takeaway is that there is a clear, evidence-based pathway for managing chronic knee pain. And the ultimate question is, where do you fall on this path, and what's the next conversation you need to have with your doctor? Thanks so much for joining us for this explainer.